All right. Well, today I'm here to talk to you about the syringe driver, which I have here. Now, the syringe driver is a small infusion pump used to gradually and continuously administer small amounts of fluids with or without medication subcutaneously. It's important that we have an RN or an EN that is IV competent before performing this procedure. Now, some hospitals will require you to do a training package in using the subcutaneous syringe driver. So you may need to complete that for safety prior to performing this skill. Now, the subcutaneous syringe driver is used for palliation of patients and other conditions. The subcutaneous syringe driver is also used to treat mild hydration where there's inadequate oral intake, and it is used for subcutaneous antiemetic administration and subcutaneous analgesia, especially for patients in palliative care. And it can also be used where there is no access for intravenous fluids or medication. Now, the syringe driver itself has a lot of inbuilt soft keys, as you can see across the face of this pump here. Now, it's important to note that the syringe driver doesn't have a battery that will last if it's not being plugged into the wall. So make sure that you do plug it into the wall. This one here is inbuilt, but not all pumps have inbuilt batteries. Now, we do have a function on this machine to show you when your battery function is alerting you that it is going to run out, and that will flash on this machine within 30 minutes of the battery nearing its life without you plugging it in. Now, most importantly, we have an on-off switch. We also have a start and we have a hold function. We have these soft keys here that we use to input things like rate and millage. It's important to note that this machine runs in mils per hour. You can see that this syringe driver uses a BD plaster pack, and this particular syringe is a 60 ml syringe, but they're not always 60 ml syringes. Sometimes they're 20 ml syringes. This medication will run over 24 hours, being continuous, and as a nurse, one of your responsibilities will be to do the hourly checks. And there are some other soft key functions down the end here. Most importantly, the alarm button, just be aware that is, so that you can turn off the noise. Most importantly, it could be 3 o'clock in the morning and we don't want this alarming and waking up patients, but then action what you need to action. So if it's letting you know that you need to do something, then do that. Now, the syringe driver is always attached to tubing, which must be primed, okay, before you get started. This medication is ordered by the patient's doctor, and you must follow medication policies as per your hospital. Here we have the Royal Perth Hospital medication administration policy, as well as the subcutaneous therapy via a subcut catheter policy. We also have just for you to remember to look at before you give any administration, look at the injectable handbook. This one's the Australian Injectable Handbook. And in addition to that, we have the MIMS book that you can have a look at, or you can look at your MIMS online at your particular hospital. Okay. Now, we follow the 6 rights to medication administration. Be aware that we do have a brown sticker. You may have seen the blue stickers on the syringes, but we have a brown sticker. And what this means is that the medication or fluid is being given subcutaneously. So it's just a safety thing. All the information gets filled in as per a normal blue sticker, and we need 2 nurses to sign that. What I'm going to talk about next will be loading the syringe. Okay, so now we're going to talk about loading of the syringe driver. All right, first I just want to point out here Mrs. Murphy's abdomen. Okay, now the subcutaneous needle can go in other areas of the body as well, where there is subcutaneous tissue, so it can go around to the buttock area or into the arm, but generally speaking we use the abdomen as first choice. Now you can see here that the patient's had a bit of surgery and they've got a suture line there, so we need to be avoiding the suture line. You can see that the catheter has been covered with a transparent sterile dressing, and that's been dated as well, just to remind the nurses when the dressing needs to be removed. Now this catheter is called a BT SAFT Intima catheter. It's quite a big long name, and it's a non-metal catheter. Just for your information, we still label the subcutaneous line as per any medication line, so that we know when to change it, and the rules are the same as per hospital policy. Most IV lines get changed, or subcutaneous lines will get changed every 72 hours, but some hospitals may want that to be done sooner, and that's to reduce things like infection. So we're still checking the site to make sure it's not showing any signs of redness or infection at all. Given that all that is good, and obviously we've just inserted this to get the procedure started, we need to insert the syringe driver into the machine. Now to do that, you see that there's a little butterfly here. We're going to slide this into the machine. It can be a bit tricky, so just be patient. We should hear a click when it goes in. And then make sure that this is also hooked at the back here. I'll just show you the back of that. There's a little hook there just for that tubing to run through. Okay, now you should try and see the patient information at the front. You'll see that there's 2 little clamps here, and I'm going to aim to put the end of this syringe into this gap here, and then I'll open up the clamp at the end and slot that in. You'll watch me do that. Okay, and then once you've done that, you can adjust any of these soft keys so that you've got your mils per hour, rate or volume adjusted accordingly. Okay, and you're ready to start. All right, so now we're going to talk about the responsibilities of the nurse. So we know that we've got the subcutaneous catheter attached to the patient's abdomen, we've got a syringe driver, and there's also a certain amount of documentation that we need to be aware of and reporting. So we're looking at the patient's abdomen, and we need to have a look at the dressing and make sure that the dressing is firmly fixed to the patient's abdomen. It doesn't look like it's peeling off or it looks wet, and if it did, we may need to replace it, or we may just be reinforcing. So I'll leave that to you to assess the patient's site. We've also got the catheter in situ. We need to make sure that it's not got the catheter tip migrating out, and that's what we call extravasation. We don't want that coming out of the abdomen, because that means that the medication won't go where it needs to. So that's really important as well. You can see that this is dated, and that's good because that's telling us when the dressing was in situ. And you can also see from as I mentioned earlier, that we've got the catheter sticker at the proximal end, and if you follow that up, it's on the distal end as well. And our syringe is in situ, labelled, and the information in our machine as we as we wanted. Now we would be doing patients' vitals as well, because as I mentioned earlier, we give different things through a syringe driver, whether that be fluid or whether that be medications, analgesics or antiemetics. So what sort of things do we need to assess our patients for? Their normal vitals are heart rate, pulse, blood pressure, rest rate, etc., because we know that some of this medication will affect our patient, and that's a good thing, especially if our patient is palliative. That may be what we're aiming for. The other thing that we need to do is look at our patients' sedation levels and alert levels, and how alert are they, and how effective is the overall medication. If the patient's needing pain relief, then we want to make sure that it's actually doing what we're wanting it to do. And if it's not, we need to go back and speak to the doctor about it and get these numbers increased within safe limits. All right, so now I'll quickly go to documentation. So there's a number of documents that we need to complete. When the catheter gets inserted, we need to write into the progress notes that the catheter has been inserted, what type of catheter it is, what time it is, and sign that progress notes. We also need to make a mention into the patient's care plan that the patient has got a subcutaneous catheter in situ, and the other things that we need to make mention of is when it was inserted or when it's removed. Now these catheters can only stay in situ for maximum 72 hours, and the reason that is because we know the evidence base tells us that the patient's more likely to get infections if we leave it in there for longer. Okay, so we need to make sure we appropriately document and we sign it on every shift. In addition to that, the patient's got fluid running, so we know that it runs in mils per hour, and we need to document that on our fluid balance chart. Now you can see that on this form it says intravenous. Now if the patient has got a subcut catheter, you can just write above that it's a subcut line, so small acronyms S/C, and then that way we can keep track of how much the patient has had per hour.